The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Hey, Shifties, welcome back to the next episode of the Shift podcast. With me today is Becky Fuentes, coming to us from Texas. Becky, thanks for joining us.
Good morning.
How are you? How's it going in Texas?
I'm great. It's wonderful here. It's actually in the 80s.
Finally starting to warm up. Um,
Yes.
so Becky, before we get started, will you let the shifties know just a little bit about your nursing career and then what your current role is?
Absolutely. I'm Becky Fuentes. I'm Chief Nursing Officer here at Shannon Medical Center in San Angelo, Texas. I've been nursing for 34 years this May.
34. I've been doing it for 31. We're close.
Yes.
You know what? Let's just go off the rip and get her started. I have a couple
Okay.
questions that I think the shifties would be really interesting in hearing from a chief nursing officer. Becky, what to you does a high-performing nursing culture look like?
Okay. Really engaged nurses are a strong belief in shared governance and having the nurses that are actually out there taking care of our patients, being engaged, making decisions, really being the ones that are helping make our policies. Help they make the decision of what equipment we use, what supplies we use, how our policies are made, bringing those best practices and in helping make those decisions. Also, not being afraid if there's a mistake made, not being afraid to bring those forward because while we're an accountable organization, we are also a just culture that we're looking at the processes, not the people. So we want to look at the processes to make sure that those errors don't happen again. That it's not about the people making an error. It is about how can we fix the process so it doesn't happen again to keep our patients safe.
I like that you said that. I worked for an organization years ago and we were just culture, high reliability, and everything you said just really resonates with me. And at at the leader level, because I love that obviously you defer to the expert, one of the principles of the HRO and leveraging your shared governance. How at the director executive level, how do how do you instill the culture at that level?
Really, and involving the leaders, we have several committees where we're looking at things like CLABSIs, CODIs, falls, having them, they lead the committees, but they involve our bedside staff. So while they're the leader of the committee and like they're bringing the metrics to the meetings, they have our bedside staff at the meetings. So it's interdisciplinary meetings with bedside staff, say like our falls committee. We have bedside nurses, physical therapy, anybody that's involved in taking the care of the patient at that level. Our med era committee, we have pharmacists, bedside nurses, and then a leader leads that meeting. So really it's working together with the team.
I do have a question, Becky, and for the shifty listening, this is unscripted, so I'm just asking Becky. Becky, have you shifted from shared governance to professional governance? Because what you described sounds very much like professional governance.
Yes, and actually that's my error because I still call it shared governance because we've been doing it for so long, but actually it is called professional governance now. They actually just made that shift about a year ago. And they actually
Um,
have we have the big group, we have an inpatient group and an outpatient group for our outpatient areas, and then they also have unit-based professional governance.
I love it. And I do this podcast, Becky, and I speak to a lot of CNOs, and that really seems to be the shift is
Yes.
shifting from shared to professional
Yes.
because we're better together. Our patients get better outcomes when we get involved with the interprofessional team. So thank you. It's you guys are doing great work. Of
Thank
course,
you.
I have to ask this question. Um, now and obviously you're a magnet hospital. One of the standards in the magnet manual and with pretty much all the American Nurse Association designations with Joint Commission, our Surgeon General, everybody is really focused on well-being and burnout. And I'm just curious, as a leader, nurse burnout, it's been really discussed for years. And really, the pandemic just really shined a light. I don't know if that's even right grammar, but we put the light on burnout after the pandemic. Um, what do you believe is still a misunderstanding at the nurse leader level about burnout?
I think actually we're on our pathway to excellence journey.
Oh,
We're not on,
okay.
we're on our
Thank you.
pathway to
Yep.
excellence journey.
Thank you.
I think a lot of them think it's about the staffing or the schedule, but it's not just about that. I think that can play into it, but it's not just about like how many shifts in a row you work or what your assignment was that day. A lot of it can be about um, there is a big since COVID. I think there is the types of patients you're getting nowadays, and it's not just the types of patients, but the family expectations, the patient expectations. Workplace violence has really increased since COVID. That is a big thing that our nurses on the front line, not just our nurses, but all frontline staff, are dealing with on a day-to-day basis. It has increased, probably tripled, I would say, since COVID. And it's not just in the healthcare, but it's all over. You see it when you go to the grocery store. You see just the behavior of people has changed. So I think you could still have the same patient assignment, the same schedule that you're working as pre-COVID, but the behaviors of people have changed. So I think that's a big burnout. I've seen nurses come to work, and within the first year, they no longer want to be a nurse. And so I think that is a big one. That
Mhm.
so it's not just about the hours worked or the assignments or anything. It's there's a lot more to it now, and work life balance is a lot different now. 30 years ago when you came in, you just came in and you worked all these hours and you really didn't think about work life balance. But now it's a big thing, and you have to really work with people to get them their work life balance.
I think so. I mentioned I've been a nurse for 31 years, maybe this year 32. I can't remember. When I became a nurse, this is true story. I worked Monday through Friday, 7 a.m. to 3:30 p.m. No weekends because they had a very robust weekend
Mhm.
WOW program. And then shortly a year into my career, we went to 2 12s, 2 8s, rotating shifts, and it's all changed. And we have to evolve in healthcare. I'm not saying we don't have to evolve, but I think in my role as the Chief Clinical and Innovation Officer here at SE Healthcare, I think some of the misunderstandings about burnout are that um, I think people feel like if I take a week's vacation, the burnout's going to go away. If I go get my nails done, the burnout's going to go away. Um, that's just not really how burnout works.
Right.
It doesn't work that way, and it's a balancing act. And as leaders, I think sometimes what I've recognized in this role is sometimes even leaders don't understand the signs and symptoms of burnout. I don't
Right.
know if you've experienced that in your network, but it's just something I've really recognized over the past couple of years.
I would agree, and even the leaders that are working the set schedules, I don't think they recognize it in their self. So
Wow.
they have a hard time recognizing it in their staff if they can't recognize it in their self. And that all people have a little bit different symptom. So some may get quiet, some may get I don't hate to use the word grouchy, but everybody's got a little bit different. Some may get withdrawn. So yeah, it's very like you said, and you're right. Going to get a manicure or pedicure is not going to fix it, and
And you nailed
everybody's
it.
a little bit different. Yeah.
Yep, you nailed it. It does present differently in everyone. It often presents different in men than women. And
Mhm.
so as leaders, I think the first thing we can do is create these cultures of awareness and meaningful management of burnout.
Yes.
I have another question.
Okay.
How do you personally, as the CNO role model, um, I want to say the word resilience, but some people don't like that word resilience. So how do you role model steadfastness? I'm going to use a different word without normalizing exhaustion.
I do try to leave here at a decent hour, and I try to encourage my leaders to do the same. Even when I hire a new leader, I try to have that conversation with them that, if it's not due the next day, it'll still be here the next day. As a leader, it's kind of like what you make of it. If you empower your people to be in charge and to make decisions, then they'll be able to do that. Even as a nurse manager, I did that with my charge nurses. I mean, they're the ones here 24/7. So my night shift charge nurses, I always empowered them to handle situations. And then, we'd talk it over the next day. And even if they didn't make the best decision, we talked it over. They never got in trouble for making a
Mhm.
decision, but we talked it over. And maybe it should have been a little bit different. We'd talk it over. I've always done that with, my charge nurses, my managers, house supervisors, but really empower people that are here to make decisions rather than micromanaging people. Because if you do micromanage people, they'll call you day and night, and you'll never get any rest or time away. Just encouraging my leaders to do the same. Yeah. And then, don't stay on your now with your phone and email on your phone. You can be tied to this place all the time. So really just encouraging my leaders to not do that. And same thing with the staff, because now the staff will try to get their email on their phone. When you're away, you're away. Try to take your time. If you take PTO, get somebody to cover for you. Just don't be that person that's tied here all the time.
And that really speaks to setting boundaries, which is critical for leaders. For actually, you mentioned people in the grocery store. I always use as an example. Everybody's different. Everybody's suffering from some kind of burnout. It's just not nurses and people in healthcare. But setting boundaries is critical
Yeah.
for self-perseverance and self-preservation. Um, at the executive level, Becky, how do you decide what deserves your time? And the reason why I ask that question is when I speak with leaders all over the country, one of the things that contributes to burnout is not having enough time, competing
Yes.
priorities. It's the most limited resource for leaders. So, how do you decide what deserves your time, Becky?
Well, for sure, patient safety is always first. So
Mhm.
if there's anything going on that that takes precedence, of course, is patient safety. Anything that with that, but to me, my number one focus is, I mean, aside from if it's a patient safety issue, is the nurses. And I feel like I am here to take care of the nurses. That's my role as CNO, is to take care of the nurses because they are the one taking care of the patients. So my role is to take care of the nurses. So I feel like I am here to be not just, I mean, nurses, everyone under nursing, the PCTs, everyone, to be their advocate. So if right now I'm working on some professional development things to try to get them some stuff with that. So really, whatever I'm working on, if I have a lot of things going on, I try to make sure I'm getting those. That is a priority to get that stuff. Whether it's getting stuff passed to the CFO or, equipment purchased or whatever. Just I kind of prioritize that way.
Well said. I love, I'm just going to say a different way. It sounds like you invest in your people.
Yes.
You're investing in the nurses and everyone that falls under your accountable leadership. So thank you for that. My last question, what leadership decision felt the heaviest and what did it teach you?
One that recently did. Um, Looking at with COVID, we had to start using
Hmm.
travel nurses, and recently looked at no longer using them. Just and it was a give and take with the CFO to try and get nurses to stay at the bedside. He actually gave me a little bit money to go into salaries, but the deal was to stop using travelers. And it was kind of like, okay, we can do this. So made the deal to, okay, let's invest this money in our bedside nurses and stop using travelers. Stop using travelers. Sorry. So I did it, and we're almost there. We've only got a couple left, but it was like, oh, this is a little scary.
Mm-hmm.
But in the long run, for quality, staff satisfaction, patient satisfaction, it's the best thing to do. But a little scary doing it.
And that is a tough decision. It's actually ironic that you brought that up, Becky. I just had a discussion last week with a couple nurse leaders, and the traveler discussion is very sensitive.
Yes.
It's very sensitive because guess what? Travel nurses are just like you and I. They're nurses. They're just doing something a little different.
Right.
Internally, sometimes, not always. Um, there's a little rub. I'm just stating
Yes.
what I hear. I'm not spreading bad news.
Right.
So the traveler situation is sensitive. It's very expensive, as you know.
Yes.
And so congratulations for you and your leadership for being courageous to make that decision, because to the point of the question I asked you, it is a very heavy decision
Yes.
on multiple levels. So thank you for being vulnerable and sharing that, because it is a very sensitive topic. Becky, when we end the podcast, I asked the shifties, because now you're a shifty, not a Taylor Swifty, you're a shifty. What one tip from your leadership journey would you like to share with everyone who's listening to this podcast?
Oh gosh. I think just stay true to yourself and be open and honest. I think I always laugh with, and actually, even when I got the position, my CEO, who I report to, we've kind of grown up in the organization together. So whenever he talked to me about this position, I tell him, with me, what you see is what you get. If anything, I'm very honest. So really just, stay true to yourself, and what you see is what you get.
I
So
No, that's really powerful, Becky, because as you know, authentic leadership is one of the principles of the AACN, or one of the
yes.
standards. I'll call it a standard. And we do have to be true to ourselves, because it is exhausting not to be true to yourself.
Yes.
So thank you for saying that. And Becky, thank you so much for shifties. Just so you know, I randomly saw Becky on LinkedIn and thought, oh my gosh, she's doing great work. She and her team down there in Texas with their pathway journey and doing just great things. And I took a leap of faith and said, hey, Becky, do you want to be on the podcast? You graciously agreed. You're doing great things. So thank you so much for joining me. And shifties, remember, your shift makes the difference. Keep shifting. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.